So welcome back, everybody. As you've seen, we put the revised program for this afternoon together. It's on your screen at the moment for your perusal. Before we jump into this next session, this is Agenda Item 6 and Immunization Agenda 2030, Building Better Health for Tomorrow. We're going to play a short video as a bumper for this session. You can play the video, please.
The European Immunization Agenda 2030 is a vision and strategy crafted by member states for achieving the full benefits of immunization in the WHO European region. It aims to create stronger and more resilient immunization systems and structures based on the key pillars of immunization equity, life course immunization, and tailored local solutions. In Tajikistan, reaching every child with polio vaccines is critical to ensuring the virus has no chance to spread in the country and cause lifelong paralysis.
من همین خونم رفتم گپ زدم کردم برای واکسینش کردن در کره خب برای پیشگیری فلج میسسترم خونه رفتم گپ زدم نمیشه مونیره
هر یک شهروند باید همین واکسین را استفاده برن برپو از طرف مثال مسائل طبی شما در یادداشت میرسونن.
The benefits of vaccines and vaccination extend throughout life. In the coming decade, immunization systems will be strengthened and expanded to protect people of all ages from many infectious diseases. In Italy, a specialized vaccination center in Rome offers expectant mothers vaccination information and services.
Il nostro obiettivo è quello di proteggere la donna in gravidanza perché si è visto che sono le prime ad infettare i loro figli se si ammalano di pertosse.
Allora, è stata la mia ginecologa che durante una delle visite mensili mi ha consigliato di fare il vaccino per la pertosse perché negli ultimi anni si sono verificati numerosi casi di bambini neonati con la pertosse. E mia figlia è stata la più grande, che ha 7 anni, è stata una di queste bambine. E quindi sono molto contenta di aver potuto fare il vaccino questa mattina.
The COVID-19 vaccine rollout has brought into sharp focus the need to tailor immunization systems to fit local contexts. It's not possible to reach everyone through a one-size-fits-all approach. Denmark has achieved high coverage with COVID-19 vaccines, including through tailored services, such as mobile pop-up vaccination points.
Vi har jo kunne se via data, ikke sådan på individniveau, men vi har jo kunne se, hvem det er, der ikke har taget imod invitationen til vaccine i de almindelige vaccinecentre. Og så har vi virkelig prøvet at sikre, at alle fik budskabet, og også at det var kendte ansigter, der formidlede nogle af de her ting.
Der er nogle mennesker, hvor det at planlægge sådan noget ind, det er uoverskueligt. At få dem ned og så stå og snakke med dem, så den der nærhed, der er i det, den har været altså overraskende vigtig.
Det er netop både for at overkomme de praktiske forhindringer, der kan være, men også for at det føles trygt.
Ja.
By strengthening immunization systems, implementation of the European Immunization Agenda 2030 will help to reduce mortality and morbidity, increase equitable access to vaccines regardless of age, identity, and geographic location, strengthen primary health care, and thereby contribute to achieving universal health coverage and sustainable development.
Thank you very much. And with that, I hand the floor back to our chairperson, Executive President, Ambassador Silanauki.
Thank you, Executive Director Rob Butler, and welcome all back, all distinguished guests. Let us now continue with Agenda Item 6, Immunization Agenda 2030, Building Better Health for Tomorrow. The relevant documents can be seen on the screen. Here you can see them. And as already nicely depicted in the video you just saw, in this session we will be discussing the immunization strategy for the next decade as conceived in the new European Immunization Agenda 2030. This is based on an evaluation of the previous European Vaccine Action Plan 2015-2020 as done in its final progress report. At the end of this session, you will be invited to endorse this new European Immunization Agenda 2030 and adopt a related draft resolution. So I would like to give the floor to the regional director, who will deliver introductory remarks setting the vision of the European Immunization Agenda 2030 within the framework of EPW. Regional Director, you have the floor.
Thank you very much, Executive President, Excellencies, Honourable Ministers, Delegates, ladies and gentlemen. Good morning and good afternoon. We are at the doorstep of a new decade for immunization. The European Immunization Agenda 2030, a flagship of the European Programme of Work, seeks to build better health for tomorrow through stronger immunization programs by focusing on three key pillars. First, equity. Second, immunization across the life course. And third, local solutions to local challenges. As we strive to contain COVID-19, the significance of vaccines is clearer than ever. Vaccines save 2 to 3 million lives every year and protects millions more. This pandemic has reminded everyone of the role immunization plays in protecting individuals and health systems from infectious diseases. COVID-19 has demonstrated the greater potential of vaccines to protect vulnerable populations across the age pyramid. 1 in every 2 people in our region have now received at least 1 dose of a COVID-19 vaccine. This enormous feat was possible in part thanks to the generous donations by several of our European member states and the multilateral efforts of COVAX. Thanks to vaccination, together with public health and social measures, we are now able to contain the pandemic, together with other measures. European Immunization Agenda 2030 is set to empower countries over the next decade to offer full vaccination benefits and will be and strengthen other primary healthcare services and build universal health coverage. Ensuring a resilient immunization system is a priority. Reaching the underserved should guide us in the coming decade, because the immunization system is only as strong as its weakest link. The European Immunization Agenda 2030, developed as a bottom-up approach, is the result of very intense consultations with more than 350 experts from Ministry of Health, National Public Health Institutes, European Technical Advisory Group of Experts, the European Commission, non-state actors. We are very strong supporters of civil society. We will keep repeating this. UNICEF and other UN agencies. Also, the United States Center for Disease Control and Prevention and Gavi. My sincere thanks to the 3 member states that are co-sponsors of the resolution on the European Immunization 2030. Kyrgyzstan, van Bolshoye, Serbia, hvala vam, and Slovenia. Thank you. This new strategy for the coming decade is a giant step forward in the larger pursuit of the Sustainable Development Goals, our compass. A few reflections on how we shape our future success. First, we must shift to data-enabled, tailored local solutions. Second, we must move to a life course approach that harnesses vaccination benefits across all age groups. And third, we must consistently monitor and evaluate progress and be accountable for the results. Immunization is a shared responsibility. the proposed high-level immunization board, which we plan to launch before end of the year, and we have the strong commitment of the patron of our office, Her Royal Highness Crown Princess Mary. This board will then promote the highest level of political engagement. Partner coordination and community engagement will also be indispensable to move beyond the last decade's achievements. Commitment is key. Commitment means that actions will follow today's words. I therefore strongly urge all of you to build a greater role for immunization in your national health plans and budgets. You know, we believe in walk the talk as we preach. So, join me now, please, in committing yourself to this movement, including by adding your voice now to the online platform. I commit. Ya Abizuyus. Thank you.
Thank you, Regional Director. Now, Dr. Siddhartha Datta, Acting Director, Communicable Diseases, Division of Country Health Programs, will report on the progress of the European Vaccine Action Plan 2015-2020 and present and outlining the characteristics of European Immunization Agenda 2030. Dr. Datta, you have the floor.
Thank you, Chair. Before I start this presentation today, I really like to acknowledge the leadership and the strategic guidance of Dr. Nino Bazzuli, Director of the Country Health Programs, who had an immense role to play in shaping the Immunization Agenda 2030 for our region. Thank you, Dr. Bazzuli. Excellencies, ministers, delegates, ladies and gentlemen, we are standing at a very pivotal moment in the WHO regional office and the region. I think it's an opportune moment that we reflect back what we have done in 2014, where we are today with the COVID-19, and where we do go from here to the next decade. In 2014, you all committed to ambitious goals and objectives. Why not make it ambitious? The European region was always and had become always far ahead than the other WHO European regions and the globe. We ensured that the region will be free of the vaccine-preventable diseases by providing high-quality, safe, and effective vaccine across life course. As we move forward into the next decade, it is an opportune moment now, let us to see in one slide, as we see into the next slide, that where are we in terms of the 6 goals that you committed to achieve. This slide should not be seen as just an achievement. The work behind this, your political commitment, is also reflected in the sense that out of the 6 goals that we have all committed to, we have already achieved 3 of them, have made substantial progress in the rest of the 2. Let me take a moment to go through this slide. The region has sustained its polio-free status, not an easy task, as we have to reach each and every child in our region with a polio vaccine. You have seen that in the slide, that efforts made by each and every healthcare worker in Tajikistan as they try to contain the vaccine-derived polio outbreak. The region went ahead to make evidence-based decision on the new vaccine introduction, and the region has achieved its financial sustainability towards the routine vaccination program. The elimination of measles and rubella, though we have not achieved as a region, but we have made substantial progress. We will delve into it in the next slide. While the region has not achieved its hepatitis B control goal, but I think it's important to see substantial progress had been done there as well. The measles and rubella, as you see in this slide, again, are not the numbers that comes up in the slide. They showed what had been your commitment, the political commitment and the commitment of the healthcare workers to provide the safe and effective vaccine a greatest tool that we have on our hand to each and every child of the region. The region made substantial progress from 2014 until 2017 by 37 of our 53 member states achieving the measles elimination status. While big outbreak in 2017 through to 2019 indicated the success is as fragile if we are not vigilant. The losing of the status of the measles elimination in the region indicated that it's important to sustain the hard-earned gain in the communicable diseases. The success in rubella, as you see on the right-hand slide, just shows an impressive amount of work being done by each and every member state, and I think it has been wonderful to see this upsurge. The only one goal that the region did not achieve is the regional vaccination target. Let us go to the next slide to see where do we stand. Let me take a moment again to go through both of these paragraphs. On the left-hand side, the regional coverage almost stayed constant from 2016 to 2019. The region failed to achieve the goal of 95% for the DTP3 coverage, the third dose of diphtheria, pertussis, and tetanus. If we scratch the regional level, it's important to zoom down at the national level. At the national level, we have seen several of our countries have a coverage of less than 90%, while some of them were between 90 to 94% coverage. This shows that we do have areas of underserved and unserved population. But when we look into within a country, that is where the equity angle of the Immunization Agenda 2030 surfaces. As you see on the right-hand side, there are different countries with second subnational areas where coverage has been less than 90%. The outbreaks that we have seen in the region of the measles in 2017 to 2019 demonstrates the presence of these pockets of population. The impact of COVID-19, I think it also provides both opportunities but as well as challenges. When we were hit by COVID-19 in early 2020, the member states of our region had made tremendous effort to ensure that the routine immunization program stays as a priority public health intervention. Several countries have done innovations to reach to these population groups when the restrictive measures were put in for COVID-19 vaccination. Several countries are successful in ensuring that the routine immunization coverage stays. But we can see that if we look into the countries by its income status, where the high-income countries were able to retain the routine immunization program, the middle-income countries have slid back. In 2019, 6% of the infants population in our region housed in these 4 countries in the middle-income with less than 90% coverage. That proportion of infants were increased to 12% in 2020, indicating that this now is an opportune moment for countries to catch up because we need to sustain their achievements. As we move into the COVID-19 opportunities, I'd really like to, again, give a big shout out to our member states for the tremendous achievement that we see on the left side of the slide. The darkest of the blue or lightest of the blue, doesn't matter. The effort and the political commitment to provide the benefits of COVID-19 vaccine to 890 million doses being administered just shows your commitment, just shows the effort made by the healthcare workers in each and every country to reach out to the vulnerable population groups. A big thank you to each one of you. COVID-19 provided us several opportunities. The investments being made by the countries in the COVID-19 vaccination rollout provides us an opportunity to create a resilient immunization system. The innovative strategies now need to be leveraged to strengthen the routine immunization program of tomorrow. Obviously, as we have seen, there's a need to catch up with a routine immunization program as the public health measures phase out. Here we start the journey towards the European Immunization Agenda 2030. As we moved into the Immunization Agenda 2030, as you have heard from the regional director, we have started this process of developing a vision and a strategy for our region way before the COVID-19 struck us. I would really like to outline this process a bit more in detail. We heard you. We heard the national priorities, that it was important to define the regional focus areas. We started this process under the guidance of the European Technical Advisory Group of Experts, Professor Finn and his team, way back in November 2019. While you were containing the COVID pandemic, you continued to engage with us throughout during this process and to develop this consultative process and then also finally land up where we stand today. As you have heard the regional director mention, we had 350 individuals and experts, organizations who came together. This is indeed a consultative approach. Thank you so much for everyone. As we move forward into the let me take you through two important things. What will this achieve and what is the vision? We envision to contribute to the world where everyone, everywhere, at every age would fully benefit from the vaccines for good health and well-being. How will we do it? We will help to attain or to reduce the morbidity and mortality caused by vaccine-preventable diseases by increasing equitable access, one of the principal pillars of the European Immunization Agenda 2030. The equitable access relates to both the existing vaccines for everyone, but also to provide the newer vaccines. But ultimate aim of this European Immunization Agenda 2030 would be to strengthen the primary health care and contribute towards universal health coverage. Immunization Agenda 2030 has got three principal pillars. Equity remains as the central component of this Immunization Agenda 2030. Equity means subnational, commune, local level. There is where the impact would be visible. The second pillar would be to provide the benefits of this vaccination across the life course. But the most important uniqueness of this Immunization Agenda 2030 would be to devise local solutions to the local challenges. To attain all these three pillars, there has to be some strategic pivots that need to be done as we move forward into the next decade. With the national leadership, we want to envision that Immunization Agenda moves towards an increased local ownership. Data-enabled, tailored national policies will form the crust of the Immunization Agenda 2030 in the next decade. Moving from a primarily childhood vaccination, Immunization Agenda 2030 will move towards a life course vaccination, but also using the life course platforms. The COVID-19 pandemic and the COVID-19 vaccination rollout has provided us those opportunities that needs to be leveraged, as we have discussed earlier. Moving from only a monitoring and evaluation framework, we envision to move towards a monitoring, evaluation, and accountability framework. The national plans and national policies will remain the modus operandi of implementing the Immunization Agenda 2030 in the WHO European region. The national policies and the plans will be guided by these 7 core principles. We have heard in the morning session about the primary health care, the value. That remains the principal overarching principle around the national immunization policies. Equity both remains as a principle, but also a means to achieve the immunization in the next decade. As we measure the overall impact of immunization, the indicators in the monitoring and evaluation framework will monitor the impact of immunization in the region, including the strategic priorities. Control, eliminating, or eradicating the vaccine-preventable diseases will remain one of the principal elements and a pathfinder for the Immunization Agenda 2030. This will allow us to measure whether the region had been able to reduce the outbreaks of vaccine-preventable diseases. We need to measure whether we are leaving anybody behind. The measurement index will be to ensure that we measure the equitable access to the vaccine. And the last and not the least would be to measure the immunization and delivery, the impact of it across life course. The political engagement and independent technical guidance will oversee the Agenda 2030. You have heard from the regional director about the high-level immunization board. This will act as a scaffolding platform for advocacy at the highest level. And as usual, the Regional Committee for Europe will remain the oversight to monitor the progress being done in the implementation of the European Immunization Agenda 2030. This goes without saying that there will be strong impetus from the Technical Advisory Group of Experts on Immunization and the Disease-Specific Independent Commission for Measles and Rubella, Poliomyelitis, and Hepatitis B to move the technical evidence process in the region. The European Programme of Work 2020-2025 has provided us that all-of-office approach towards ensuring all the 4 flagships contribute to not only to itself, but also to the other. The implementation of the European Immunization Agenda 2030 remains an all-of-office commitment within the framework of the European Programme of Work 2020. As I finish my presentation, it is important that we acknowledge what Katrina in her video, as we have seen, has told us. It is extremely important that we overcome any practical barriers. Immunization program can do it. It serves almost a mirror to the health system and to the performance of the immunization systems in general. But I think we also have to make sure, as she says, to make it feel safer. The recipient need to come to us as we also walk our journey towards it. The journey, as we have seen, thank you, Regional Director, for showing your commitment onto the commitment board. Yes. We really urge you, as you have received the link and the Zoom box now, to show your commitment. As Regional Director says, our words today need to start into an action for tomorrow. Thank you so much. Thank you, Madam Chair.
Thank you, Dr. Daza, for this clear overview. To complement the picture, I will now invite the Chair of European Immunization Technical Advisory Group of Experts to provide his perspective on the situation of immunization in the region in the next decade within the context of the COVID-19 pandemic. Professor Finn, welcome. You have the floor.
Good afternoon, dearest colleagues. It's a real privilege to continue to work with the excellent WHO Euro team. A lot has happened since the last time I addressed this regional committee meeting in Rome in 2018. The world has changed, and we're entering a period both of great risk and great opportunity for immunization in the European region. Risk, because the economic and social consequences of the pandemic are vast, and because progress with many other non-COVID vaccine programs has been halted or even reversed, and in many cases are in urgent need of repair. Opportunity, because public and political awareness of the threats posed by infectious disease and understanding of the potential of vaccines to prevent them are at an all-time high. Vaccines are preventative tools. The best time to deploy them is in anticipation of events. As post-pandemic normalization proceeds, the need to address the looming threat of resurgence in measles and rubella in particular is now becoming urgent. But the drastic measurements forced on us by the pandemic have also taught us what it can be like to live without other infectious diseases. Due to lockdowns, influenza and other respiratory and gastrointestinal viral infections almost disappeared. This was a great blessing at a time when our health systems were at breaking point. But it also shows us clearly the massive savings and benefits that driving down rates of infectious illnesses can bring us. Now, lockdowns are not a viable future strategy to achieve those, but vaccines are. Vaccine programs cannot succeed without public trust, and that is hard to earn. It takes honesty and transparency and a long time. The public will accept vaccine programs that are driven by objective, independent, expert scientific advice. The need for strong, well-resourced, and well-respected national immunization technical advisory groups, or NITAGs, has never been greater than now. Finally, every chain is only as strong as its weakest link, as we just heard. Every country in our region has locations, communities, and groups whose access to and acceptance of life-saving vaccines is low. Instead of comparing nations with each other, let's look inwards. When we level up within our countries, the European Immunization Agenda 2030 a strategy which has been developed by the member states of the WHO European region, together with WHO partners, paves the way for us to offer the benefits of the vaccines to everyone. The third decade of the 21st century has begun with the greatest global infectious diseases crisis for a century. COVID vaccines are a critical part of the solution, but all our vaccines must now be our focus if we are to end this decade knowing that we really did what we could do for the health and prosperity of all our citizens. Thank you.
Thank you very much, Professor Finn, for your perspective as the region looks into the future. To launch this ambitious new agenda on immunization, some member states have expressed their interest to be the proponents of this EPW flagship. With the committee's permission, I would like to give them the floor first. Can I first invite Kyrgyzstan to take the floor, to be followed by Serbia and Slovenia? Delegate from Kyrgyzstan, the floor is yours. Do we have a connection to Kyrgyzstan? No. Before we organize that, is Serbia there available? I would then go to Serbia. Or Slovenia. Do we have Slovenia available? In the air?
Well, Chair, distinguished Regional Director, Excellencies, ladies and gentlemen. Vaccines are one of the greatest achievements of public health to date. They are a cost-effective way of preventing millions of deaths every year and ensuring protection from disease and disability. We thank the Regional Director for attributing such an importance to immunization, to have included it as one of the flagship initiatives of the EPW. Furthermore, we greatly appreciate the work of the Regional Office for revising the lessons learned from the past and present and conducting an inclusive process which has given us the European Immunization Agenda 2030. We fully concur with the 7 core principles and 7 strategic priorities of IAE 2030. And we think they largely come down to 3 words: science, strengthening, and solidarity. We need science and innovation to provide us with new vaccines and ways of delivery. Moreover, we require scientific behavioral insights to be able to understand and overcome one of the most pressing challenges of today: vaccine hesitancy. This is where strengthening comes in. The need to strengthen our primary health systems for delivery, awareness raising, and generating demand for immunization. Strong systems also enable rapid detection of vaccine-preventable diseases and deployment of vaccines, which of course also need to be supported by stable supply chains. These are crucial for immunization programs to function during outbreaks and in calmer times. Finally, there is solidarity. We need to ensure that access to vaccines is not limited to a few privileged countries or even communities. Immunization is one of the keystones of universal health coverage and thus the Sustainable Development Goals. Inequalities within countries and between them need to be eradicated. Despite challenges, we have seen some truly outstanding innovation in vaccine distribution mechanisms, namely COVAX, which can serve as a model for other vaccine sharing initiatives in the future. I am proud to repeat the words of our Prime Minister from yesterday, who has declared that Slovenia is among the top donors of vaccines per capita and will contribute to provide support until necessary. Excellencies, it is an honor to have co-drafted the resolution on the European Immunization Agenda 2030, along with partners from Serbia and Kyrgyzstan, and closely consulting the EU member states. I kindly invite you to adopt the resolution and bring the European Immunization Agenda 2030 to life. I thank you.
Thank you, Slovenia. Now I would give the floor to Kyrgyzstan, if we have them ready now. Yes. So the floor is yours, please.
Здравствуйте, уважаемые коллеги.
Good afternoon, distinguished colleagues. On behalf of the Ministry of Health and Social Development of Kyrgyzstan, I'd like to welcome the participants of the 71st Regional Committee and thank you for giving Kyrgyzstan the opportunity to help define the European Immunization Agenda for the period leading up to 2030. Immunization is, of course, one of the most effective and cost-effective types of healthcare intervention. Now, given its role in preventing infection and mortality from the growing number of infectious diseases, immunization is critical for achieving Sustainable Development Goals. The COVID-19 pandemic has created unprecedented disruptions in healthcare systems, including national immunization programs, and has had a negative economic and social effects on countries. In addition, it has revealed the vulnerabilities in national immunization programs in Kyrgyzstan and throughout the world. At the beginning of 2020, immunization coverage dropped sharply. This was the case for many other countries. Kyrgyzstan was forced to temporarily suspend routine immunizations. To increase vaccination coverage in Kyrgyzstan, we began to use mobile medical units, which allowed us to quickly expand routine vaccine coverage. This innovative method has been used to deploy our routine immunization program since 2018. Thanks to these implemented measures, we were able to restore immunization services by June 2020. In addition to restoring routine vaccinations, the immunization program was actively included in our COVID-19 vaccination campaign. This was a difficult task which required the combined efforts of Ministry of Health personnel, as well as those of many other agencies, and of course the support of our development partners. We believe that we ought to make use of the lessons learned during the COVID vaccination process in order to create or to strengthen existing platforms for vaccination across the life course. In light of the COVID vaccination experience, we must continue to increase awareness of the benefits of vaccines beyond early childhood. We need to take an approach based on vaccination across the life course in order to achieve mass vaccination. Therefore, we support the implementation of the European Immunization Agenda 2030. We believe that the draft resolution is extremely important for strengthening the primary health care system, as well as for achieving universal health coverage, since a key goal of the European Immunization Agenda is improving health in the future through immunization today. And we can achieve this by focusing on 3 priority areas: equity in immunization, immunization across the life course, and local solutions to local challenges. Thank you for your attention.
Thank you. Thank you, Kyrgyzstan. Calling Serbia, could you please give your statement now? It seems that there are some technical problems and we can't now get Serbia online here. So I would then go to the other member state statements, and we have a pre-established list of delegates. Here you can see it, and I'm going to follow it now, and we will have possibility for Serbia then to come on floor when we get the connection to them. So we will begin with Turkey's statement, followed by Israel and Russian Federation. Turkey, the floor.
Thank you, Chair, but Turkey will not make any intervention. Thank you again.
Thank you, Turkey, and then Israel. The floor is yours.
Honorable Chair, Ministers, Ambassadors, and colleagues, immunization had become more than a hot topic during the COVID-19 pandemic than it has been for years. And I would share some of our experience, and I have to say that one way that we had managed to supply early for COVID-19 immunization was through a unique partnership between industry and government. And it's certainly the responsibility of the government, but the use of the private sector and the industry was crucial for us. So this partnership between industry and governments allowed immediate cold storage and trained professional handling of vaccine without overwhelming of our public health system in a more efficient way. Partnership can be used to expand the production capacity and improve distribution and access. Equity is certainly one of the most important pillars, as the regional directors and others had mentioned. And equity of vaccine accessibility will be achieved in our eyes through a public and private partnership, leading to a dramatic and drastic increase in vaccine production and a more efficient distribution system. It is still ours as countries and international organization responsibility to push ahead and lead this effort ahead and really put the boundaries and the rules properly. I have to say that despite the incredibly high rate of pediatric immunization in Israel, Israel, unfortunately, is no stranger to anti-vax movement and vaccine hesitancy. In Israel, we had many unique sectors in our society. So much as a diversity is beautiful, but still present a unique issue for us. We had to run a system of advocating and explaining and educating in six different languages for unique communities in Israel. And we do believe that a task force is needed to create, I would say, outreach to every and each community in our different countries. Task force that would understand properly sensitivities and the way to properly deliver complex information, which is so necessary when we are here trying to create less hesitancy and more trust in our claim for much more wider vaccination program. Further, I have to say that information that we need has no borders. And we do call the regional approach in combating vaccine hesitancy and anti-vax notions and sentiments. And that could be done in our eyes by creating a wide multi-task, multi-system task force that would create a better data sharing, a better information sharing, and better understanding how to approach the public and reduce this type of hesitancy and help us to achieve the goal of the European goal of 2030. Thank you very much.
Thank you, Israel. Give the floor to Russian Federation, followed by Germany and Spain. Russia.
Thank you very much, distinguished chair. The Russian delegation in principle strategically supports the European Immunization Agenda 2030, which is based on the principles of equity, accessibility of access of immunization, vaccination throughout the life course, and resolving national problems through national solutions. The EIA, given experience with implementation of the European Plan of Action, Vaccine Action Plan up to 2020, has already achieved major goals, which is very important. But it also has led to a breakthrough in immunization within and between countries, which we see today, including due to the pandemic. We also plan to focus on expanding immunization, vaccination, and disease control through preventive measures. We support the key principles and strategic priorities, as well as the objectives and action areas of this agenda, including with regard to the comprehensive approach toward primary health care, including immunization. We are committed to immunization, to its equitable access throughout the population, strengthening oversight over the operative responses toward vaccination, using scientific data and using innovative approaches for decision-making, as well as strengthening vaccination programs in, of course, sustainable financing as well. The Russian Federation in September 2020 adopted a strategy for the development of immunizations for infectious diseases for the period leading up to 2030. This was developed based on the above-mentioned principles and priorities. It serves as the basis for our country's rolling out of comprehensive measures to prevent and contain the spread of, eventually eradicate infectious diseases through vaccines. Russia has developed a plan to implement this strategy. This resolution provides for compliance with key principles, priorities, and action areas of the European Immunization Agenda. Therefore, the Russian delegation supports this agenda. Thank you for your attention.
Thank her for the Russian Federation. And next, I would like to give the floor to Germany, followed by Spain and Republic of Moldova. Germany, please.
Vielen Dank, Frau Vorsitzende.
Thank you, Madam President. The COVID-19 pandemic has underlined the importance of vaccines once again. The rate of vaccination in Germany is going up thanks to a national campaign this week in my country. People are now able to turn up at particular locations and get a vaccine without an appointment. Ladies and gentlemen, vaccines are one of the most cost-effective prevention measures. Polio, measles, all these important vaccines are available and the rates are high in our regions. I'd like to underline 3 points. 1, we must advertise vaccination.
Und auch Unentschlossene vom Nutzen überzeugen.
And we must convince individuals to get vaccinated. In order to have a global protection, vaccination must take place all over the world. Moreover, we must learn lessons from COVID and implement those lessons in our health systems. We need to consider the structures that exist in our countries and all over the world in terms of primary healthcare. This is the only way for us to achieve the goals of the Immunization Agenda 2030 and ensure that no one is left behind. The pandemic has had a great impact in the European region. We face so many challenges, so we must undertake great efforts so that we can tackle these impacts. The European Immunization Agenda can play an important role here because vaccinations protect us from the outbreak of diseases, they avoid complications, and they save lives. I'd like to thank the regional office for their leading role on this topic. Secondly, digital solutions make it possible for us to accelerate vaccination campaigns and reach at-risk groups. This is useful for monitoring of vaccination campaigns, and we should ensure that we strengthen the use of digital technologies in this sense. We should have clear targets here. This means indicators can be used to evaluate the situation and make adjustments if needed. When planning these interventions, it can be much easier if you use digital technology. For instance, when you coordinate supply chains, you provide appointments online, and you report side effects this way too. We've been doing this in Germany. We want to become a digital health center of excellence. We need to ensure that we support those involved in these actions. Thirdly, we must consider animal health and human health together at the global level. At the moment, we have separate supply chains for medicines as well as for animals and humans. We need to do what we can to make this more efficient. Perhaps we can combine these two activities. Finally, we need to ensure that decision makers at the high level have an important role, particularly on this technical advisory group that deals with this topic. Germany will continue to support the WHO Europe And I thank you for your attention.
Thank you, Germany. Next, I give the floor to Spain, followed by Republic of Moldova and Norway. Please, Spain, the floor is yours.
Chair, dear colleagues, Spain supports the draft resolution European Immunization Agenda 2030. Spain has a vaccination rate for vaccines included in the national vaccination schedule. The COVID-19 vaccination strategy in Spain aims that susceptible population over the age of 12 years can be immunized in the shortest possible time. Currently, is one of the countries in the world with the highest doses of the vaccine against COVID-19 administered. This has been achieved with an extraordinary reinforcement of the entire healthcare workforce during the pandemic and especially to meet the objective of vaccination. A national health system oriented to the patient and the personal responsibility of the citizens of our country. Spain continues to bet on research, innovation and development of new vaccines against COVID-19. The Spanish Agency for Medicines and Health Products has authorized the clinical trial of IPRA-PHH1B vaccine against COVID-19. This is the first human trial of a vaccine developed in Spain for COVID. But we need to continue advance together until we achieve highest rate of vaccination at European and world level and leave no one behind. Spain continues to bet on the donation of vaccines for COVID-19 through the COVAX mechanism. Thank you, Chair.
Thank you, Spain. Next, Republic of Moldova, followed by Norway and Kazakhstan. Please, Republic of Moldova, your statement.
Honorable Chair, distinguished delegates, ladies and gentlemen, Republic of Moldova. Okay. Republic of Moldova used this opportunity to renew commitment to achieve better health and well-being for its own citizens across the life course. In this respect, the immunization importance has never been so clear and understood by each of us as in these days. It is unfortunate that COVID-19 and the avalanche of misinformation that has accompanied the pandemic led to a decrease in confidence in vaccine, and we have seen decline in the immunization rate of children in the Republic of Moldova. At the same time, the ongoing COVID-19 vaccination efforts create new opportunities to strengthen national immunization program and build better resource system to achieve vaccine preventable disease elimination and control. Due to timely mobilization and implementation of specific actions covering all impetus areas of the national deployment and vaccination plan, the Republic of Moldova was the first country to receive COVID vaccines through COVAX platform. In a very short term, our country reached over 90% of vaccination coverage among healthcare workers, translated into significant decrease of virus transmission in health facilities. Following the principle that schools should be the last to close and the first to reopen, priority immunization actions in our country also targeted the staff in educational settings, achieving over 70% of vaccination coverage in this group through dedicated cross-sectorial efforts. In line with the WHO European Immunization Agenda, Moldova has made tremendous effort this year in increasing human resource capacities to use evidence-based information as well as escalating digital solutions. Real-time, accurate data never been so important and valuable for government, mass media and general population, redefining data for action. As we move forward, the Republic of Moldova sets an ambitious goal for implementation of the national immunization strategy for the next 5 years to save lives and protect the health of population through achieving high and equitable vaccination coverage throughout the life course. In line with the SDG agenda, the main strategic priority of the national authorities is to ensure the immunization program is an integral part of the primary health care and is focused to achieve universal health coverage and ensure political and financial sustainability. Madam Chair, colleagues, the Republic of Moldova fully supports the resolution of the European Immunization Agenda 2030 and highly appreciate collaborative efforts by the Member States supported by the WHO to protect all age and all population through resilient immunization systems and structures. Thank you for your attention.
Thank you, Republic of Moldova. And next on my list is Norway, followed by Kazakhstan and Austria. Norway, please.
Thank you. Chair, delegates, Norway supports the enhanced focus on immunization. In particular, we support the principle of implementing vaccination through primary healthcare services. Vaccination programs need to be properly funded and supported by national governments. Immunization programs have been suffering from lack of attention during the pandemic, leaving many children at risk for disease. Additional effort is needed to make sure that all children receive necessary vaccinations. Norway supports the focus on immunization across the life course. With an aging European population, this will improve health, quality of life, and life expectancy for the elderly part of the population. Sharing experience and best practice in order to increase vaccine coverage across countries and regions is important for future success in vaccination. During the COVID-19 pandemic, there has been a close and fruitful collaboration between ECDC, WHO, and the National Immunization Technical Advisory Groups, the so-called NITAGs. Close collaboration should be extended to more general vaccination issues. An extensive monitoring and evaluation and accountability framework is suggested. We strongly encourage this to be based on routine surveillance systems and not on unique questionnaires and surveys. This can strengthen the quality of surveillance for vaccine-preventable diseases, immunizations, adverse events, and stocks and logistics for vaccines, data already needed in the country, and it will reduce allocation for standalone reporting. Vaccine hesitancy is a major threat to the success of the EIA 2030, and reasons for declining to be immunized varies between countries. More research is needed for the causes of vaccine hesitancies and ways of minimizing it. We look forward to seeing the results from the agenda in a few years' time. Thank you.
Thank you, Norway. Next, Kazakhstan, followed by Austria and Finland. Kazakhstan, you have the floor.
Chair, distinguished colleagues, currently in our national vaccine calendar, we are carrying out anti-infectious disease vaccinations as well as coronavirus vaccinations. We also have sustainable financing for vaccination from the state budget. And all those that undergo vaccination have a right to this funding. Kazakhstan is free of polio, and it oversees its vaccine program. We also have a robust measles and mumps vaccination program. We have a high level of vaccine coverage as well. 2020 had a negative effect on rural vaccination coverage in our country. Currently, This year, despite the continuing COVID-19 infection rates, we have not stopped our routine vaccination campaigns. Currently, we are attempting to vaccinate more children who were not able to receive their shots last year. The sound is too low for interpretation.
Доступно для населения 5 видов вакцин. Это вакцина «Спутник Ви», отечественная вакцина «Казвак», вакцина компании «Синофарма», произведенная в Объединенных Арабских Эмиратах и в Китае, и вакцина производства «Синовак». Доступ к вакцинации имеют все лица старше 18 лет. На сегодня первым компонентом привито 37% от численности населения, вторым компонентом 31% от численности населения. На сегодня Казахстан рассматривает тоже вопрос, проводит подготовительную работу по вакцинации детей, начиная с 12 лет. Для обеспечения максимального доступа вакцинации против ковида прививки проводятся не только в организациях здравоохранения, но и используются передвижные прививочные кабинеты, то есть передвижные мобильные комплексы. Вакцинация проводится также в местах массового скопления населения. На сегодня, как и все страны, которые сегодня докладывались, мы также испытываем недостаток информации, научно подтвержденной информации по эффективности вакцинации. Это очень важно с точки зрения борьбы с антиваксерами. К сожалению, это движение набирает свои обороты. На наш взгляд, необходимо разработать системную стратегию по повышению доверия населения, объединив усилия. В целом Казахстан поддерживает проект резолюции и инициативу ВОЗ в рамках Европейской программы иммунизации и будет предпринимать все усилия, способствующие достижению цели в области иммунизации. Благодарю за внимание.
Thank you, Kazakhstan. It seems that anyhow here we didn't got English translation for whole of the text, and I apologize for that. Try to correct that for future statements. Next, I would like to give the floor to Austria, followed by Finland and Netherlands, and then I have no other delegates on the pre-established list, but please raise your hand on the Zoom platform if you would like to make a statement. But now, Austria, the floor is yours.
Thank you, Madam Chair. Dear colleagues, in the sake of time, I refrain from talking about the success stories in the context of COVID-19 and the European and national vaccination rollouts. But in the light of the current increase of the number of vaccine-preventable diseases in Europe, Austria supports all core measures and strategic priorities listed in the European Immunization Agenda 2030 to enhance vaccination coverage. In particular, we consider the shift from a one-size-fits-all approach to a data-enabled, tailor-made national action plan that addresses epidemiological needs and low threshold, easy access for all groups of people to be indispensable for equal vaccination coverage. We believe that it is now, as soon as possible, important to restore the quality of surveillance and to carry out important revaccinations. This is the only way to prevent the risk of an outbreak of other vaccine-preventable diseases. Furthermore, we are convinced that a good communication strategy and the strengthening of health literacy are vital elements as the prevailing vaccination hesitance is high. In the next 10 years, special focus should be placed on vaccinations against COVID-19, of course, MMR, varicella and herpes zoster, with a better mumps component, as well as effective vaccines against pertussis, influenza and HPV, especially with a view to increased acceptance. With regard to vaccine supply and logistics, we fundamentally support the content depicted in the EIA 2030. The role of the regional office in strengthening national vaccine procurement capacities and mechanisms, as well as supply chains and ensuring timely availability of vaccines of assured quality, is important, as mentioned in the draft resolution. Vaccine shortage should therefore generally no longer be an issue in Europe in the future. So Austria supports the draft resolution, and I'm yielding back to you, Madam Chair. Thank you.
Thank you, Austria. And then I give the floor to Finland, followed by Netherlands. Finland, the floor is yours.
Thank you, Chair. Regional Director, Excellencies, Delegates. Finland considers vaccinations across the life course as one of the most important public health functions carried out by primary health care. We support the proposed European Region Immunization Agenda 2030, and we welcome particularly the focus on addressing vaccine hesitancy. The monitoring of the implementation of the European Immunization Agenda 2030 should make use of existing structures both globally and regionally and avoid duplication and additional reporting burden to member states. We believe optimal moment to establish a high-level immunization board comes when higher share of population has been vaccinated against COVID-19. The pandemic has underlined the importance of global, regional operation, preparedness, response, and countermeasures. We consider COVID-19 vaccines as global public health good and crucial for the ending of the pandemic. The Finnish government is strongly committed to vaccine solidarity, and we are preparing to share COVID vaccines through COVAX as part of Team Finland. Team Europe. Research, development, and increased production capacity and availability of vaccines in the European region and beyond are essential for the well-being of all of us. Thank you very much.
Thank you, Finland, and then Netherlands, and then we won't have any more delegates on the list. We? No. So, Netherlands, the floor is yours.
Thank you, Madam Chair, Regional Director, and distinguished colleagues. The Netherlands fully endorses the importance of immunization programs and supports the resolution towards the EIA 2030 goals. The aim to reduce mortality and morbidity due to vaccine-preventable diseases for all age groups across the life course and in all communities and regions fully aligns with the Dutch vaccination policy. The uptake of new and existing vaccines in a national program, after careful weighing of pros and cons, will remain a decision to be made at the national level, but countries can benefit from international guidance, other countries' vaccine developments and experience. It is important to develop innovative communication strategies with a people-focused approach aimed to reduce vaccination hesitancy by providing the information needed as well as countering misinformation in order to achieve a high vaccination coverage in all groups within the population. And vaccination services should have the time, skills, and possibilities for person-to-person conversation and consultation about vaccine hesitancy and necessity. This is one of the priorities in the Dutch strategy to strengthen the vaccine coverage. Basics about infectious diseases, immune system, and vaccinations should not only be part of the training of healthcare workers, but also be a part of the biology curriculum in secondary education. And in the Netherlands, we have implemented a successful teaching package for this. So we are indebted to the Research Committee for bringing us the COVID vaccine in the shortest time imaginable. But we can go further than developing new or improved injectable vaccines. It should also encompass new, innovative techniques to deliver vaccines such as nasal vaccines and dermal plasters. And as we learned from the COVID experience, it's important to share research findings across countries as soon as they are available in order to create the biggest impact, for example, by combining databases. And in order to achieve optimal vaccine accessibility, we should encourage voluntary technology transfer and transparency in licensing agreements. And transparency is key also in quality control and vaccine delivery, for instance, with country-by-country audits of each other's vaccination programs, using the strategic priority indicators. And we need to work closely together with the WHO to ensure a robust monitoring and evaluation framework. Thank you.
Thank you, Netherlands. And because there are no other delegates on my list and no international organization, partner organization has either asked to have a statement or to make a statement, we will go to the joint statements from non-state actors here. And we have three joint statements, and we will take first, you can see them here on the screen, and we'll take first International Federation on Aging and the other organizations that are mentioned there after that. So who would then give the statement on behalf of that joint group? Please, the floor is yours.
Thank you. Distinguished colleagues, on behalf of the International Federation on Aging, IFA, and other non-state actors, immunization contributes to 14 of the 17 Sustainable Development Goals. As stated in the Immunization Agenda 2030, immunization is a vital component of global health security and ensures a world where people of all ages, especially vulnerable and at-risk populations such as older people, those with chronic conditions such as diabetes, and high-risk mothers and infants fully benefit from vaccines to improve health and well-being and prevent and control fatal infections. With the disruptions caused to global healthcare systems by the COVID-19 pandemic, a significant decrease in routine immunization coverage in 2020 was noted in countries in this region. The introduction of new vaccines has also revealed vaccine hesitancy. From the perspective of the allergy patient, much hesitancy is linked to vaccine safety, especially with the risk of adverse reactions, whether short or long-term. A life course approach towards immunization must be seen through three key priorities: prevention and education, access, and equity. The European Vaccine Action Plan 2015 to 2020, EVAP, provides a comprehensive and coherent framework to achieve goals and objectives. While significant progress has been made, the region is not on track to eliminate measles, and periodic outbreaks continue to occur. This is just one example why protecting progress made in immunization must be at the forefront of all governmental and civil society actions. Pan-European attention is required to ensure the region's achievement of the WHO cervical cancer elimination goal, including the targets for HPV vaccination. For global advancement and the sustained success of EVAP goals, strong partnership with communities and civil society organizations are needed. The undersigned, we call upon member states in the Europe region to examine status and plan future immunization through recommendations, prioritizing immunization as part of a people-centered public health plan through primary healthcare as a central component of universal health coverage, as marked with the 2018 Astana Declaration. Expanding current tailored vaccination strategies to address immunization gaps through identification of susceptible populations, removing barriers, and implementation of evidence-based interventions. Improving uptake of new vaccines and reducing vaccine hesitancy and other barriers through the development and delivery of effective evidence-based public health messages as a policy lever. Building on models developed during the COVID-19 pandemic, track and report on country-by-country progress on vaccine uptake. Integrating immunization with other services such as antenatal care, school-based vaccinations, and long-term care services to improve access. Setting country-sensitive targets that are responsive to the local environment and priorities to provide realistic goals that reduce inequities towards achieving global targets. The International Federation on Aging and other non-state actors fully support the resolutions made by the committee towards the proposed European Immunization Agenda 2030. Thank you very much.
Thank you. The next statement will be given by Karen Bioro, International Council of Nurses. The floor is yours, please. Do we have?
I think, Madam, it might be actually Mervi Jokinen from EFMA who is going to give the statement.
Please go on.
Okay, thank you, Madam Chair, esteemed colleagues and delegates, and thank you for the opportunity to read our statement on behalf of the International Council of Nurses and the European Forum for National Nurses and Midwives Associations, who welcome the European Immunization Agenda 2030, Building Better Health for Tomorrow. Nurses and midwives of Europe are strongly committed to immunization programs to ensure everyone at every age fully benefit from the vaccinations for good health, well-being and sustainable development of Europe. As a flagship initiative of the WHO European region, the EIA 2030 has the potential to drive needed renewed political commitment to our immunization programs. Nurses and midwives are the largest clinical providers of immunization in Europe. Findings from the recent ICN survey on COVID-19, mass immunization shows nurses play a key role in increasing the vaccination rates and reducing vaccine hesitancy, particularly by supporting development of education resources and tools. As the most trusted professions, nurses and midwives support community engagement, increase health literacy, and build public confidence in immunization. In many of the countries that are highly effective in immunization, nurses and midwives are involved in national strategies and committees for COVID-19 vaccination. National nurses associations and midwives associations offer important contributions to national strategies and can swiftly mobilize the nursing and midwifery workforces. National nurses associations and national midwifery associations can also facilitate planning and delivery of mass immunization through the established relationships with policymakers, service leaders and regulators. ICN and EFMA call on member states to involve nurses and midwives and their organization planning, management, implementation and monitoring immunization programs at all levels. ICN and EFMA support setting up higher-level multi-stakeholder immunization board by a regional committee to promote the highest level of political engagement and ensure that the immunization stays at the top of the national health agendas. As nurses and midwives are the key stakeholders of the EIA 2030, we strongly recommend inclusion of the government chief nursing and midwifery officer as a member of European Technical Advisory Group of experts on immunization to support mobilization of nursing partners at country and regional levels and to support the coordination of technical support. Thank you very much.
Thank you. And I have been informed that the next joint statement will be given by Mariona Borrell Arasa, International Federation of Medical Students. Is that right? Or whoever there are who is giving their statement, please go on.
Yes, thank you. Honorable Chairperson, distinguished delegates, Honorable Regional Director, representatives and delegates of the WHO European Region member states. We, the International Federation of Medical Students Associations, are convinced that access to medicines, vaccines, and healthcare is a basic human right. COVID-19 has been a huge threat to health systems and human health globally, with far-reaching impacts. Worldwide vaccination is our only way out of this urgent emergency to rebuild our systems and protect ourselves and those at risk. With the rate of vaccination increasing in many countries in the European region, the matter of third doses has arisen, with the aim to boost immunity against COVID-19. Amidst this debate, we would like to underline that the decision of booster vaccines needs to be made based on solid, independent evidence regarding their effectiveness and safety. For this, we urge member states and the WHO to support such initiatives throughout the European region and worldwide. Through the vaccination grade within the WHO European region has reached almost 70% according to the ECDC. This has unfortunately not been the case for all countries worldwide. The richer nations have secured more than enough doses to immunize populations, while developing economies have large difficulty acquiring small amounts of vaccines. Vaccine nationalism serves none of us. Widespread vaccination is necessary to contain the spread of the virus and the rise of new variants. It is the key to achieving a speedy recovery around the globe. Thus, we call on member states to continue tackling COVID-19 from an international and global perspective by contributing to the COVAX movement and ensuring price transparency to ensure access to the vaccine to all. Lastly, we would like to underline that access to medicines and vaccines must be a continuous focus and must remain an important issue, transcending the COVID-19 pandemic for the WHO and our member states. International coordinated efforts to ensure access to medicine and vaccination, such as the Immunization Agenda 2030, are essential for our work in achieving health for all and reducing health inequalities. Thank you for your time.
Thank you. I then tried, and we have tried to get connection to Serbia, and we have get now information that they will be ready in some minutes, but I suggest now that we suspend the discussion here. We have heard all the other statements, and I would now like to give the floor to our regional director, because there have been a number of comments made and specific questions raised in the intervention. So our regional director, Honorable Regional Director, the floor is yours.
Thank you very much, Madam Executive President, and thank you to all the member states and the partners for this very strong commitment. I heard how much you value vaccination as one of the most valuable preventable tools. In fact, your participation in the session today demonstrated your strong political commitment on this EPW flagship. I really need to sincerely acknowledge your contribution towards global and regional solidarity linked to the sharing of COVID-19 vaccines, donations to COVAX, and the bilateral donations. As I always have been telling since the start, international solidarity and national responsibility are for me not mutually exclusive. Science, strengthening and solidarity as outlined by Slovenia is greatly acknowledged, as is the engagement with the private sector as outlined by Turkey. It showed how we forge new partnership. That is also at the core of the Oslo Medicines Initiative, and of course we have to do it in a realistic dialogue with the private sector, goal-oriented and according to the FENSA regulations, which we always do. Educating population of the benefits of vaccination and the use of digital technology in immunization, as outlined by Germany, is indeed very valuable. And I would like to thank Germany for the support in strengthening evidence-informed decision-making in the region. Immunization is a key part in the basic health services package in every health system. And therefore, we agree immunization and primary healthcare go hand in hand. Immunization service delivery and system performance provide a good mirror of the performance of the health system in total. We say here in-house that immunization is a very good proxy for how your health system is working. All of the advances in the last 9 months have drawn from experience gained through routine immunization and must now also be harnessed to further strengthen routine immunization systems that, as Professor Adam Finn reminded us, must be driven by objective, independent expert scientific advice. Data and evidence-driven approaches, including financial sustainability as outlined by the Russian Federation, is key. Innovations and research then, which was stressed by Spain, is also critical as we move into the next decade. Data sharing, yes, highlighted by the Netherlands, is noteworthy because this is what I call the #1 condition to further put pressure on the virus. Building back better, but also building forward stronger, are vital to prevent a comeback of polio, measles, rubella, etc. And national stakeholders supporting the restoration of immunization services in Kyrgyzstan is the demonstration that together we can. Equity has been mentioned time and again. We believe in equity. It's both a tool and an objective. We have heard this repeatedly. As I said yesterday, leaving no one behind is not just a slogan. It is our collective duty, ensuring that everyone at every age, in every location, has equal access to vaccines. It's the only way to spread the disease and to ensure that all have opportunities to achieve their potential and contribute fully to their communities. WHO firmly stands with you to address vaccine hesitancy, including demand and acceptance issues. Last week, as many of you know, we had a regional meeting with the 53 chief medical officers on this matter to share experiences. The regional approach on combating vaccine hesitancy using a task force model as suggested by Israel is spot on and very much part of devising local solutions to the local challenges. The Republic of Moldova and Kazakhstan outlining the role of immunization in achieving the SDGs is also spot on. Data-enabled, tailored immunization, national policies and enhancing surveillance outlined by Austria is critical. Further on the vaccine hesitancy, because this question is coming in, and in fact, at least 3 times a week, we have video conferences with Prime Minister cabinets, with Minister of Health teams on this issue. While the big headache in the beginning was access to the first COVID-19 vaccines, now we have more and more countries, and it doesn't matter whether it's in the West or the East, where countries have vaccines, but the population is hesitating. So understanding the drivers and the barriers of immunization perception is the key. Still, with all my respect, I can say that we see in several countries that policies are being made based on perceptions and assumptions, but not on data. And for this, we need formative research. And our team has a lot of experience in this. Any local level interventions to address vaccine hesitancy should be based on local understanding of demand and acceptance issues. And very interesting, in fact, this was literally the same that Dr. Anthony Fauci, the chief medical advisor to the President of the United States, yesterday was telling. It was exactly the same wording, transatlantic. So vaccine hesitancy should be seen also as a population's concern and a health-seeking behavior. Remember, one of the 4 flagships that we established even before the COVID-19, the Behavioral and Cultural Insights Unit. It means we all have a role to play. Ladies and gentlemen, today is just the first step towards providing the benefits of the vaccines to our population in the pan-European region. You, member states, partners, civil society, nurses, midwives, for sure we'll make sure that the nurses, midwives are represented on the immunization board. You're all making a giant step in protecting the population of today and that of tomorrow. A huge responsibility is on us, but you're here together. Thank you.
Thank you, Regional Director. We can now consider adoption of the proposed draft resolution contained in EUR/RC71/ConfDoc/7 draft resolution European Immunization Agenda 2030. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objection. The resolution is therefore adopted. And as Serbia has been one of the proponents of this EPW flagship, I give the floor to Serbia to applaud this adoption of resolution and give their statement, and then I close this agenda item. Serbia, the floor is yours.
Thank you very much, Madam Chair. Esteemed colleagues, on behalf of the Ministry of Health of the Republic of Serbia, it is our honor to take part in the 71st session of the Regional Committee of the World Health Organization, and it is our great pleasure that we have had an opportunity to contribute to the development of the resolution we will be adopting and adopted today. Even though immunization is one of the most effective, most cost-effective, and indeed effective measures for the prevention of communicable diseases, we are aware of decline in regular immunization coverage caused by vaccine hesitancy. Diseases that we were almost extinct are now resurfacing as the collectivity immunity drops, leading to new cases and deaths after many years during which they had not been registered in numerous countries. The pandemic has disrupted not only healthcare systems, but the society as a whole, with unfathomable consequences. The discovery and production of sufficient quantities of safe and effective vaccines were set as goals that the entire world aspired to at the beginning of the last year. Goals that were achieved in extremely short time. However, a lot of work and many challenges still lie ahead. Strategic priorities envisaged in the resolution of the European Immunization Agenda by 2030 represent the foundation for the improvement of national immunization programs and disease surveillance systems for vaccine-preventable diseases. In addition to reduced incidence and mortality for these diseases in near future and their gradual elimination, another objective is to increase the capacities for early detection and quick response to outbreaks of vaccine-preventable diseases. All countries in the region share a common task to accomplish the goals set in this resolution by achieving and maintaining a high immunization coverage in all age groups by providing continual availability of high-quality, safe vaccines, improving cooperation among sectors, building human capacities by providing additional education for healthcare workers, but also by implementing new strategies to provide for immunization services, availability, and promotion of immunization in line with locally adopted determinants that affect vaccine hesitancy. Additionally, investments in the improvement of vaccine-preventable diseases surveillance are necessary, as well as in response capacities for future outbreaks using experience gained in the COVID-19 pandemic, such as established methodologies and technical requirements for mass immunization campaigns. In addition to advocacy at the national level, international cooperation and exchange of experiences are of the key importance for the achievement of regional targets related to containment and elimination of vaccine-preventable diseases. We therefore invite all countries in the European region to set immunization high on the list of national healthcare priorities, so that by adopting the resolution of the European Immunization Agenda, we can all together set the cornerstone for immunization promotion, scientific and technological advances in this field, and high population coverage among all age groups with safe and effective vaccines on the path to a healthier and a safer future in Europe and worldwide. Thank you very much.
Thank you, Serbia. And with this, I close agenda item 6.